I'm Dr. Kaylee Usher, founder of the International Arthrofibrosis Association, and together we're going to explore people's lived experiences of knee arthrofibrosis. The goal of this discussion is to help patients and clinicians everywhere understand what we're dealing with, the variation in arthrofibrosis symptoms and the misunderstandings complicates the diagnosis and treatment. We know that knee arthrofibrosis is quite common and even minor surgery can be the initiating insult. So differences in what tissue has been injured and the strength of the healing response, how long it's been going for, the specific location of the dysregulated healing results in different outcomes for various people and affects the range of movement, the pain differently for different people. And the symptoms depend on where the healing cells, the scar tissue and the contractions and adhesions are located. So as a result, people everywhere find it difficult to get a diagnosis and appropriate therapy. So in this discussion, we'll hear about what people from around the world have gone through with their arthrofibrosis journey, and I look forward to hearing your stories. So, Tom, could you please tell us a little bit about yourself, where you're from and about your knee?
Yes, of course. Thank you, Dr. Asher. My name is Tom. I'm 29 years old. I am from Luxembourg in Europe. And I had a football accident back in September 2023, so almost 2 years ago now. And it was a quite severe accident because I had ACL, PCL was also affected, meniscus was affected, so all departments of the knee were affected, and I developed arthrofibrosis immediately after my injury, which I did not know back then. But yes, I had surgery, reconstruction surgery, yes, more than 1 month from my injury. And yes, the doctors, I have to say that the doctors, they did inform me very well about arthrofibrosis. They knew about conditions, so I was prepared. So I was prepared how it could evolve, but however, it evolved much worse than thought. But that's for the continuation now.
Thanks very much. Gina, could you tell us about yourself, please?
Sure, thank you. I'm Gina. I'm from the US, and I developed arthrofibrosis immediately after a total knee replacement, right at 1.5 years ago.
Okay, so that's been quite a long journey for you. Yeah. And Masood?
Yes, I mean, you said my name. My name is Masood, and I live in Switzerland. I'm about 40 years old, and my symptoms started after a sport injury. I felt a sharp stabbing pain under my kneecap while jumping, and it was I think in 2016, and until 2021-22 I was undiagnosed, and I underwent 2 surgeries on my patellar tendon, and after each procedure my condition got worse. Worsened significantly. And after the last surgery, it was a patellar tendon lengthening. I was finally diagnosed with arthrofibrosis and excessive scar tissue formation.
So, how did that patellar tendon lengthening affect you? Did that make it a lot worse or better? Or?
At that time, I was doing just physiotherapy, and I didn't get better. And after 2 years, my doctor at that time decided to do an operation and surgery on the patellar tendon. But after all this, we knew that it was arthrofibrosis from the beginning on, and the patellar tendon was okay actually. Yeah.
So perhaps not a helpful surgery.
No, at all.
Yeah,
No,
okay.
yeah.
Yeah, thank you.
Yeah, you're welcome.
And Matt, how about yourself?
Yeah, thank you, Dr. Usher. I'm Matt. I'm from the United States. In December of 2022, after decades of successful athletic endeavors of all sports, I had a very severe ski injury and tore my ACL and MCL. The MCL tear was not a complete tear, so I spent 10 weeks rehabbing my MCL. It felt great. In fact, the best my knee has felt since that injury was the day before I had ACL reconstruction surgery. I had reconstruction surgery in March of 2023. For about 3 weeks or so, I was steadily progressing after surgery. My knee was feeling pretty good, although it was still very swollen. And then I started complaining about a tightness in right around my patella tendon, right in the fat pad in front of just below my knee, my kneecap. And my physical therapist said, well, that's strange. Let's keep working. And we kept working, and I kept doing weight bearing. And a few weeks later, I met with my surgeon. He took one look at my knee and he said, you have arthrofibrosis. And that was the first time I'd ever heard the term. I knew nothing about it before ACL surgery. I knew nothing. I'm a professor. I've read a lot. I did extensive research about ACL surgery before. I never saw the word arthrofibrosis in any of the information about surgery. Although I've since learned if you look up arthrofibrosis, it's a common complication of ACL surgery. But I didn't know anything about it. My surgeon instructed my physical therapist to intensify our efforts to find extension. I was in excruciating pain. I had developed a cyclops lesion as part of the arthrofibrosis. And in May of 2023, I had a second surgery to remove the cyclops lesion and cut away the scar tissue. After that second surgery in May of 23, had maybe 2 or 3 weeks where I was starting to feel better. I was getting better extension and flexion. And then things went south very quickly after that. And pretty much returned to where I had been before surgery. I developed another cyclops lesion. I developed very intense stiffness. And I was desperate, to be honest. In fact, I contacted IAA. In that feeling of desperation, I was just looking for anyone who understood anything about arthrofibrosis. My surgeon had obviously known what it was, but didn't know how to treat it. You put me in touch with a physical therapist in Switzerland who was the first person I had ever spoken to who seemed to have any understanding of arthrofibrosis. And although his recommended treatment plan didn't work in the sense that I still needed another surgery, I did find a surgeon in the US who had expertise in arthrofibrosis surgery. I had a third surgery in October of 2023. My recovery was completely different than I had done for the first 2 surgeries, which I can go into later. And within about 3 months, I had restored the ability to walk. I started with 1/10 of a mile a day, and then I was 2/10 of a mile a day, and then 3/10 of a mile, and slowly built up. And although I have a permanent condition of arthrofibrosis, and I do not have full extension or flexion, I can live my life in a relatively normal way. And so I'd be happy to go into all the details about that.
That's fabulous. So do you still get pain after standing and walking?
I don't get pain from standing and walking, although I do have moments or days where my knee gets much worse. In fact, I just had one two weeks ago where I was just actually watching the Ryder Cup on television with my legs straight, and my knee, it started in the back of my knee and it just sort of spread, and my entire knee was inflamed, and I couldn't walk for about 12 hours. But I had learned the treatment, sort of how you deal with arthrofibrosis. I was able to get the inflammation to calm down. I think of my knee as like a petulant child that just doesn't listen. And you have to be really, really careful with it. And if it gets angry, it is impossible to deal with. But as long as it's calm, it's okay.
I think that's a nice approach. The knee is in charge. The knee rules.
The knee rules. Yeah, you have to be nice to it.
I think you've found that as well, haven't you, Gina? Because you've had quite a bit of pain, haven't you?
I have. I immediately could tell after surgery that something was wrong. I wasn't able to, even before I left the hospital, to bend my knee. And they had said, this is the range you need to be bending at before you leave, 90 degrees. It wasn't possible. And I did have severe pain with physical therapy, and was continuously told to keep pushing. I had some problems with pain relievers, so they were telling me that's why you're experiencing more pain than the other people here, is that you're not, on all the narcotics that some of them are on. So it's just been a trial and error, and like Matthew said, it is, I want to say day to day, but it's moment to moment. Some things make my pain worse, some things don't. I am learning what does, but it can surprise me. Something that I think would be fine for me to do is not. Something that I think, oh wow, I'm going to really have pain from that, like almost falling, something like that, and I'm okay. So it's very difficult to determine what causes the pain and the levels. Although the levels have gotten better over the last year and a half, the intensity of the pain was unlike anything I've ever experienced the first 6 to 7 months. And it's gradually gotten better. It can flare up pretty bad, but nothing like that initial pain, because that was, I couldn't imagine living with that forever. That pain, like you said, Matthew, I was desperate. I really needed some help or some answers, and I wasn't getting those.
I think you're all in the same boat in terms of it's fairly long term after the initiating event. So you've all had it for a while, but you can probably remember back to those early days when the inflammation was really, really high. Would you all agree that that was the worst pain for you now? And is the pain sort of getting better over time, do you think, at least to some degree?
I would definitely say that that's true. The intensity of the pain when I had the Cyclops lesion, like Gina said, I never felt anything so intense. I definitely have more of what I feel now is discomfort, lack of range of motion, and then some moments of, wow, that did not feel good. And occasional flare-ups. I mean, the flare-up I had a couple weeks ago was the worst flare-up I'd had in a year. But I think the point that I'm learning is that the flare-ups don't just sort of go away over time. They can still come back, and maybe they're less frequent, maybe less intense, but they don't stop.
So is there anything particular apart from the experience you just told us that can cause a flare-up?
It's really unpredictable. I mean, I feel like, honestly, it feels sort of like an organism inside my knee. And if you upset any one part of that organism, the whole thing just flares up. Like, I feel like I overstretched my hamstring, but because of where I had a hamstring graft for my ACL surgery, and so I feel like it's all connected. And if I put too much pressure right on my patella, sometimes that flares it up. But it feels like it spreads, like I said, almost like an organism that's all interconnected.
So how about you, Masood? Do you think there's anything in particular that upsets your knee? And has the pain sort of got better over time, do you think, apart from, from that initiating event?
My symptoms?
So is there something that causes your knee to get worse, like if you've walked for too long or stood for too long?
Yeah, I mean, especially after like loading my knee, like deep squats or extension, like from bending to strengthening the knee, is almost impossible, and that causes, and of course, standing for more than 20 minutes or keeping my knee bent for over an hour, it causes significant discomfort. Yeah, walking
So
actually doesn't cause me pain. Very like it's kind of interesting, but like running or high impact activities are almost impossible. And the thing is that my affected knee, which is my right knee, is like it feels always warmer than the other knee, and the skin around the kneecap is very sensitive.
Mhm.
And I feel like, as Matthew said, something like a tumor or something like, yeah, inside my knee. Yeah.
So how about you, Tom? Anything in particular that sets your knee off?
Yes, I can relate to what you three people say. I like the analogy of the angry knee that Matthew described. So if there's a flare up, the knee behaves a bit like a child who does not want to obey, and treats itself like a totally different organism. And when we talked about pain, so I never had much more pain than the first ACL and PCL surgery that I had. That was it was heavy, but the pain and the inflammation, they got lower. But I developed patella baja also, and now I had patella baja surgery in March this year, so almost 7 months ago. And now I only realize that with my patella baja condition, that was the pain it was constant. It never goes away. You cannot stand for more than a few minutes. Walking is nearly impossible for a long time. And now it's only now that I realized that I had too much pain 1 year ago. So also mentally, that was quite difficult to tolerate. And now I'm on a better way because I realized that I'm in a much better condition now because I don't have patella baja anymore. And so I look forward to my healing process. And I have never been more optimistic than now because I went through too much pain. So
That's
I'm quite
very good
optimistic
news.
now. Yes.
Yeah, excellent.
Mhm.
So I heard you mentioned some heat and sensitivity around the knee. Have others of you experienced that as well? Is your knee warmer than the other knee? And is it
Yes.
sensitive to things like heat and cold
Well,
or touch?
Well, I live with the arthrofibrosis condition now for more than 2 years, and I have to say that yes, with a low mechanical load, if whatever walking or a physiotherapy session that was too long, I have immediate flare-ups and I feel them, and I feel the heat mainly in the anterior interval part, so below the kneecap. And after after a small period of immobilization of the knee, it's immobile, it's thick, you cannot move anymore. So I learned to deal with that, to restore my load, to not walk too much. And you really have to pay attention to how much you load the knee. Now I'm in a situation where I feel less warmth. There's always warmth, but it's much less. That's, for me, I think that I'm on a path of progress. So that's
excellent.
That's what I feel. Yes.
How about you, Gina? Is your knee warmer, and do you get abnormal sensations, say from cold or something that's just a nice warmth, like a sun on dark clothes, for example. Some people, it feels like there's a blowtorch on their knee. Do you get any of those sorts of things?
Yeah, definitely. I initially, the heat was just so uncomfortable. Any kind of fabric against my knee, even riding in the car with the sun shining on my knee we had to take a towel just for me to go to therapy because I felt like I was being burned. I kind of use the heat of my knee as an indicator if I've overdone or if I'm on the right path. I had read something about trying to achieve more of a homeostasis with the tissue. And that heat to me tells me I've done too much or I'm aggressively doing too much of the therapy that I'm working on. So my goal is always, I do feel of it a lot to see what it feels like. And the cooler, the better. That's always my goal. And I use that when I maybe increase some of my exercises to see what it feels like. If it's starting to feel warm, I know don't progress. Go back just a little bit with that. Something irritated it and kind of, got it flared up. So that's definitely always been an issue. I'm finally getting to the point where it's comfortable to have fabric or blankets, things like that on my leg. Still, any type of clothing that puts any pressure on the skin is uncomfortable, but that sensation has been with me from the beginning, and it's an odd sensation. It feels like a burning nerve sensation. So definitely.
Yeah, I think that's quite a common experience, unfortunately. How about you, Matthew? Do you get that?
Yeah, what everyone else is saying, I agree. I've definitely been using heat in the same way Gina has. If my knee is warm, it's inflamed. If it's inflamed, it's angry, and if it's angry, it won't allow me to do what I want to do. So I spend a lot of time icing, and then using that signaling to know whether or not I'm pushing it too far. In the same way Gina was saying, my entire shin is incredibly sensitive to all the things people were describing. I would say I have nerve problems that go from my knee almost down all the way to my ankle. And it's slowly gotten a little bit better over time, although it almost feels like if you hit your funny bone and you have that tingling sensation in your arm, it feels the same way right down my shin. And very sensitive to touch. I mean, there was a point after the third surgery where it felt, even just a touch felt like knives being pushed into my shin. And it's not as intense anymore. That sort of dulled down a little bit, but it's still there. It feels very different than my left shin.
I think that's a very useful tip, actually, to use the knee as an indicator of the warmth of it, so you can compare it to the good knee or just to your hand. And if there's some additional warmth there that the other knee doesn't have, that you can use that as a gauge for how your knee's responding, the amount of inflammation. And ice when necessary. That's a good tip. Thank you both.
Yes.
Yeah, it's almost like there's a little bit of a fire, some embers that are always lit, and there's sand on top, and if you put on the wrong or the right kindling, it's going to flame up, and if you don't, you can keep it in that very low grade flame.
Yes. Can I add something to this? So warmth as an indicator of inflammation is very important, as we discussed. So what I always do, and what helps me a lot, so if I have some activity, if I have dinner with friends, anything that involves walking or standing, when I get home, I do immediately cool down when I realize that I have increased warmth. So I try to get on the stationary bike only for 5 minutes, just slow revolutions in order to fuel that circulation in the knee, or have a small cool down on the CPM of the continuous passive machine, just only to fuel that circulation. And I have to say, it helps me a lot with warmth. So it's just, I have to say, warmth does resolve with slow movement, and that helps me a lot during my day.
That's
Yes.
really interesting. Yeah, that you mentioned continuous passive movement. I find that personally helpful for my knee. I'm interested to know what your experiences are with CPM, as we call it. Everyone, Gina, I think you use CPM.
I do. At your recommendation, that is probably the first thing. I know you recommended that. I've been using it for about, I guess it's been about a month and a half now. It's the first thing that I feel like is helping me make progress. The bending of my knee is very limited. I can only bend my knee about 15 degrees. And that machine, I start with a vibrating platform. I can only use for about 3 minutes. And then I transition to the CPM machine, and I do that for about 15 minutes, 4 times a day. And that seems to be what's keeping my knee a little bit more flexible. My walking has been easier because of that. And I feel more stable on my feet because of using the CPM machine. It's the first thing. I was very afraid of it because my bend is so minimal. I was terrified. Was this going to force a bend? I've gradually moved up just tiny notches at a time. Maybe every week to 2 weeks, I can move it just a little bit higher. That really gives me a lot of hope that maybe next year at this time, I'll have increased quite a bit. Just seeing that small progress over a month and a half, I feel like it's the right thing for me. If I had used it elsewhere or by someone that was forcing it to bend more than I can, I think it would have been really detrimental. But in the capacity I'm using it in, which is there any pain here? I've thought about the analogy of bending your fingers backwards, that stretch. And so if it goes any beyond that, I stop and readjust. And I don't move past the 15 minutes seems to be about right for me. It gives me some flexibility without causing more inflammation. So I've just broken it out through the day. That continuous kind of movement throughout the day seems to be the most helpful. Sitting too much with my leg down will cause it to get worse quickly. Standing or walking too much will do that. Unlike Tom, I haven't been able to use it yet for relief when it's inflamed. That's immediately elevation and some ice to kind of cool it down. And then I'm able to go back to using the CPM.
Yes, that's what I also do, but I do the CPM after I ice my knee. So just in order to get some circulation for the fluid in the knee, that really helps me personally. But it can be different for everyone.
Mm-hmm.
But personally, that helps me a lot. So I ice first and then slow circulation.
Yeah.
Some people actually have the ice pack on their knee while they're doing CPM as well. So 2 in 1.
Okay.
Do you have any experience with CPM, Matt?
Yeah, go ahead. Go ahead, Masood.
Oh, thank you. I only had the experience just right after the surgery, but really, what really helped me was, like Tom said, stationary biking, very high frequent with almost no resistance.
Yes.
Helped me a lot. And what really helped me was also foam rolling, which I knew from yoga, which I almost every day use it for my both legs. And it helps a lot to circulate the blood. And what really also helped me was the short walks, like for maybe 10 minutes or 15 minutes, just on a flat ground. Yeah.
Mm-hmm. So what do you do with the foam roller? Do you stretch your quads and your hamstrings, or what kind of exercises do you do with the foam roller?
I mean, my quads for sure, and I don't know how's the name of this on the side. I mean, for my hamstring, I can't do anything, but on the side, I just do it, and it really helps a lot. Yeah.
That's interesting.
So you feel less pressure on the knee after foam rolling, or what?
It somehow releases the pressure on the knee afterwards. I mean, I just lay on the ground maybe 2 minutes afterwards after foam rolling, and it really helps. I can't recommend to everyone.
Do you think?
Thank you.
Do you think that's a
Welcome.
kind of massage? Do you think that's the effect that it's having?
Yeah, I mean, massage help also me a lot, but as there is no one to do it for
Yes.
me, I just do it with the foam roller. I mean,
Yes. Okay.
yeah. But I do the whole leg. I mean, I do it from the upper side of my quads until my top of the knee. I mean, I just roll, and yeah.